Hi everyone, I'm Dr Suruchi Agarwal, Consultant Pediatrician and Pediatric Diabetologist at Columbia Asia Hospital, Whitefield. With November being recognized as the month to raise awareness regarding diabetes and November the 14th being recognized as World Diabetes Day, I'm here to talk to you about type 1 diabetes. Type 1 diabetes is a distinct form of diabetes which occurs in children and young adults due to the lack of secretion of insulin, leading to high blood sugar levels and the consequences related to it. Now, why does type 1 diabetes happen? Type 1 diabetes occurs when the immune system of our body attacks the cells in the pancreas that produces insulin, and over a period of months to years, the production of insulin decreases and then stops, leading to high blood sugars and consequences leading to type 1 diabetes. Now, why this autoimmune process is triggered is really not clearly known. However, genetic factors combined with infections with viruses and bacteria are known to be a causative agent. How is type 1 diabetes diagnosed? Initially, children can present with symptoms of diabetes that can be quite subtle, but they can be classified into the 4 T's. Now, what are these 4 T's? They are thirsty, toilet, tiredness and thinner. Children with type 1 diabetes are extremely thirsty, drinking large quantities of water through the day and passing large amounts of urine even in the night, and sometimes children who are dry in the night do start to wet their bed. They also lose a lot of weight despite having a good appetite, and they appear tired all the time. Now, if type 1 diabetes is not diagnosed at this stage, they develop extremely high blood sugars and the blood ketone levels increase because of the use of fat to produce energy, leading to a life-threatening condition called diabetes ketoacidosis. Unfortunately, in India, we still see a lot of children presenting with diabetes ketoacidosis, and to raise awareness regarding the 4 T's is extremely important so that these children can present sooner rather than with a life-threatening presentation. The diagnosis of diabetes is extremely simple with a simple finger prick blood sugar test which shows a high blood sugar. How is diabetes treated? The treatment of type 1 diabetes is normally through a team approach, a multidisciplinary team with the child and the family at the center, being supported by the diabetologist, the diabetes educator, the diabetes specialist nurse, a nutritionist and a psychologist. It requires the ability to maintain the blood glucose within the normal ranges, avoiding large fluctuations to either a low blood sugar or a high blood sugar. And the main thing that is required in the treatment of type 1 diabetes is insulin, the hormone that is secreted by the pancreas. Insulin needs to be given through multiple daily doses in an injectable form, either through a pen or an insulin pump. And the dose of insulin is determined by the blood sugar, which is again detected through multiple checks of blood sugar through the day, especially around meal times and at times of exercise. It is also determined by the food that you eat, especially the carbohydrate content, and also by the exercise or activity levels. Overall, it's a complex balance that decides the insulin dosage to maintain the blood sugars in a normal range. With all these interventions, children with type 1 diabetes can lead a healthy life, doing all their activities as they would want to, and avoiding complications with long-term high blood sugar range. It is important to remember that type 1 diabetes is completely different from type 2 diabetes, and it is not lifestyle and not diet or any other factors that influence the development of type 1 diabetes. Type 1 diabetes requires long-term and lifelong usage of insulin, and raising awareness of the early detection of type 1 diabetes is extremely important. Thank you.